everyone. My name is Kim Smolderen. I'm a clinical psychologist and outcomes researcher at Yale University, and I'm here today with my colleague, Carlos Mena-Hurtado.
Good afternoon. I'm an interventional cardiologist by training and director of vascular medicine here at Yale. I have the distinct pleasure of talking with my esteemed colleague, Dr. Smolderen, about an upcoming AHA statement that touches an area that is front and center of some of the research that we are doing in our vascular outcomes program, and that certainly touches millions of people around the world. And that is the connection between mental health and cardiovascular disease, and specifically peripheral vascular disease. So Kim, over the last 10 years or so, you've done pivotal work on the relationship between mental health and cardiovascular disease. If you wouldn't mind sharing with us, certainly, the motivation from your perspective about studying this topic, particularly the issues associated with depression, pain management, and other mental health disorders.
Yeah, thank you for highlighting this topic. And I have to go back early in my training when I was working with this population in the vascular surgery clinics in the Netherlands, where our role was to look for psychological screening and support for these populations, but we noticed that few resources were available, and this was not really documented as much. So I think what we have worked on over the years is highlighting the gaps and the needs in terms of psychological risk factors such as depression, chronic stress, and anxiety, and how that impacts outcomes. And really now brought that together, that this is a problem impacting patients and their families, but also interacting with the care and the outcomes that they can expect for their vascular disease. So doing this now in an effort with the writing panel has been a good exercise, and will highlight why it is important to look at these factors and start thinking about care solutions to address them.
Most of us that have the traditional approach to PAD management based upon wound care and or revascularization have come to understand that the multidisciplinary approach to the management with patients with peripheral vascular disease is of paramount importance. How do you think that our statement will help practicing providers to implement this type of approach in their all local environment?
Yeah, I think raising awareness is one goal of the statement. I think a lot of us may still not be aware how this may impact outcomes such as the risk of amputations, length of stay after a revascularization, and how difficult it becomes for people if they are affected by chronic stress or depression to adhere to guideline recommendations, or how they cannot take the directions for their lifestyle changes or their management overall in a way that maximizes their success. And more, we are already talking about team-based care, both for the cardiovascular spectrum at large, but also specifically in the PAD setting. We have more multidisciplinary team-based care settings for preventing amputations. And I feel like it's a natural extension to start thinking about adding behavioral health specialists to those team-based approaches. So that is something immediately to reflect upon and see how those specialists can be added to the team. And then a third thing that hopefully this statement might do is have broader conversations with the health system, what those benefits for the health system at large, but for the patient population may mean if we start adding this care, and how may this improve outcomes so that this also can be quantified and made more sustainable.
Thank you, Kim, for that answer. So another question that comes to mind is that, as you've seen, the issue of mental health has been more and more important, not only across cardiovascular disease, but across pretty much all domains in medicine. What do you think that our future trainees, meaning the future generations, should be taught, or how should they incorporate the elements that you just alluded to in their training, so that when they are practicing, it becomes more natural, the extension and application of those concepts.
Yeah, I think that's an important point. Knowing how stress impacts atherosclerosis and prognostic outcomes, what the mechanisms are really key insights for both specialist training in cardiovascular specialties, but also for behavioral health specialists who want to work in this area. And then if we can facilitate co-training experiences between people training in cardiovascular medicine, as well as folks who train and pursue a behavioral health career, I think that would help shape the experiences of true integrated care. And perhaps we need to also be thinking about more subspecialization that would really design and teach the care pathways that are relevant for each particular subpopulation, in this case, PAD, because there's a lot of technical knowledge that we both don't know from each other. And I'll ask you a question back. Cardiology and psychology seems like a combination you might not think of at first hand, but what can we learn from each other's profession to really move this field and this subspecialty of cardiovascular psychology forward to support people with severe vascular disease, for instance?
Well, I think that a lot of work needs to be done, and certainly the awareness that we're trying to raise among providers in general, trainees, mid-level providers, is going to be of paramount importance. I think that having an open mind to the idea that it's not just a leg, but it's a whole body, and it's not just pain, but it's the entire human being that is in front of us, and that we need to be able to incorporate all those different dimensions in the treatment that we offer to our patients is important. If we continue to compartmentalize the management of our patients, we're destined to fail. I think that the more holistic we are and the more discussions we have with our colleagues around this, the more likely that we'll succeed. It doesn't mean that we have to know every single aspect of the care of our patients, but what it does require is that we're humble enough to recognize what our patients need and offer to them. I think that in the statement, the way it's written, and you did an excellent job recruiting a group of authors that are multidisciplinary in nature with different approach, but that we have something in common, which is caring for the patients with cardiovascular disease. It's an important step forward. I think that the American Heart Association clearly is committed to the implementation of this multidisciplinary care management of patients, and I think is a very much needed and welcome statement, and hopefully it will help many, many patients across the U.S. and obviously the world. Thank you.
Thank you. I think those are nice concluding words, and I would add to that, it's all of our responsibility to help contribute to reducing the stigma around mental health, and hopefully this statement will help contribute and continue the discussion in the field.